Hi, beautiful people. How are ya? I hope you're having a great day. Let's get right into it. These are the 8 types of fibromyalgia pain according to Verywell Health. They are and today is part 3 of the series Types of Fibromyalgia Pain. Part 1 was on hyperalgesia. Part 2 was on widespread pain and fatigue. And in this video, we'll discuss temporomandibular joint pain that causes temporomandibular joint and muscle disorder, or TMJD, or simply TMD. So here we go. So the other night, my husband made this huge hamburger, and I looked at it and I thought, there is no way I'm going to be able to bite into that. So I did what I always do. I take small little bites, and it takes me forever to eat it. I usually blame it on my dry mouth, which is a fact and does make eating take longer. And I blame it on the dental surgery recently that I just had, which is a fact because I can't chew on my left side, at least not until it heals. But what I'm not blaming it on is my TMJ. Did you know that nearly 70% of fibromyalgia patients experience facial pain near the TMJs? Right here. Goes back into here. And while about 35% of fibromyalgia patients have a diagnosis of temporomandibular joint pain, I thought for years that what I was experiencing was normal and everyone experienced it, until I told someone and they looked at me like I was the color green. And then my dentist diagnosed me with TMJ and made me a bite guard to wear at night to keep me from grinding my teeth. But that didn't stop me from grinding my teeth during the day. Just the drive from home to work or from work to home, I was grinding my teeth. And doing that causes a lot of pain in this area. So this is the temporomandibular joint. It's involved in the jaw joint, and the masticatory muscles are involved. The mandible, or lower jaw, is the only movable bone of the skull. On each side of the mandible is the ramus of the mandible, and rambus means branch. There are 2 upward going bony projections, as you can see here. The more anterior is called the carotenoid process, and the posterior projection is the condylar process of the mandible, which is topped off by the oval-shaped condyle. Condyle. I have to look that up. Oh, this is real life YouTubing. I started editing this video, and when I paused the video to look up the word condyle to make sure I was pronouncing it right, I would swear I turned my recording back on. Apparently I didn't. So I've already pulled my hair up, as you can see, took my jacket off, because I had to pick my granddaughter up today from school and take her to her internship. So I want to quickly finish recording this for the second time. So my apologies. Here we go. The condyle of the mandible articulates or joins with the mandibular fossa and articular tubercle of the temporal bone. Together, these articulations for the temporomandibular joint allows opening and closing of the mouth. So, we learned that the lower jawbone or mandible connects to the temporal bone of the skull via the temporomandibular joint, which allows us to make these movements. TMDs are a complex clinical problem related to the dysfunction of the jaw joint and masticatory. Masticatory means when we chew something that increases salivation. Mastication, or chewing, is controlled by 4 muscles of the face. The most powerful muscle of mastication is the masseter muscle. It is attached to the jaw and elevates it. The temporalis is a broad muscle that fans out to cover much of the temporal bone on the side of the skull and also elevates the jaw and retracts it. The lateral pterygoid muscle is the major opener of the jaw. And lastly, the medial pterygoid muscle originates in the front of the skull and attaches to it, adjacent to the eye socket. It elevates the jaw and assists in lateral side-to-side movement. I do hope that you find all of these details as interesting as I do, because these details matter. Because if you're like me, you may disregard your pain as not real or insignificant, but TMJ pain is no joke, and it involves a lot. So that's why I am explaining it with so much detail. Now that we know what the joint is and what muscles are involved, we can begin to understand how the symptoms correspond with the jaw. TMD involves a dull, persistent ache that affects the ear, temple, eyes, lower jaw, or neck. These are the usual symptoms of TMJ. And wow, what a lot of symptoms that is. It's not just jaw pain, but your jaw could be making a clicking or popping sound. You might have teeth grinding. You might have difficulty with chewing. I do. You might get chronic headaches or migraines, or feel dizzy, or have tingling or numbness in the fingers. This area right here, where the jawbone connects to the temporal bone. Oh my goodness, I am so sensitive here. Too much touch there, pushing, will send me to the moon. Very sensitive to touch. Just part of the experience of having TMJ. Do you have that as well? Just wondering. Misalignment, also called malocclusion, is a condition where the jaw position is not properly aligned. Jaw problems like misalignment can cause pain and discomfort and make it difficult to open your mouth wide. Yep, I deal with that. It can make eating difficult, and in severe cases, the person can have trouble speaking or have breathing problems. Quote, alignment issues can cause your teeth to dig into your gums or lips, or make you more susceptible to tooth decay, tooth damage, or even tooth loss, unquote. If your jaw feels a little stiff or sore, and it's hard to open your lower jaw wide enough to yawn, You might have a misaligned jaw. Misalignment can cause you to compensate in various ways, leading to additional aches and/or chronic pain in the jaw joint. Headaches and temple pain are also a sign of misalignment. The stress on the muscles in the head and neck leads to headaches. That clicking or popping noise you hear when you move your lower jaw, well, that's a sign too. According to TMJ.org, disc displacement is an internal derangement of the disc that acts as a cushion between the skull and lower jaw. In the early stages, an anteriorly displaced disc returns to its normal position during mouth opening and is accompanied by a clicking or popping sound. I have that. This is referred to as an anterior displacement with reduction. In later stages, when the disc becomes more anteriorly displaced, it acts as a barrier to condylar movement and limits mouth opening. This is referred to as anterior displacement without reduction, or closed lock. There are two main causes of disc displacement. The most common is trauma to lower jaw, and the other reason is a change in the frictional properties of the joint due to degenerative changes in the joint surfaces caused by chronic tooth clenching and grinding habits, bruxism, or it could be arthritis. But you don't have to have TMJ to have a displaced disc. We need a physiologic dentist, one who is trained in the practice of creating the optimal alignment for our bite and addressing the painful symptoms related to misalignment of jaw joints and related soft tissues. Yeah, I'm bringing this up at my next appointment at the end of the month. I'm sure I need a new orthotic, I would think. I feel like I've wasted money on the ones that I bought in the store because I can't seem to get them to fit properly. Have any of you had success? I know the ones the dentist has made for me are very expensive, so I don't know if I'm going to go that route either. In a 2023 study, researchers stated that bruxism, functional limitation, and masseter hypertrophy, temporomandibular joint pain and chronic pain were significantly higher in women with fibromyalgia than in healthy controls. Well, this study happened to be all with women, but that doesn't mean that men can't get the same thing. Also, myalgia, or muscle pain, and disc displacement with reduction was significantly higher than healthy controls. Not surprising, right? TMD is an umbrella term that refers to not only painful diseases affecting the jaw muscles and temporomandibular joint, but also functional jaw problems such as locking and clicking. Also, in a 2018 study, researchers stated that there are comorbidities between TMD and conditions like IBS, fibro, and chronic fatigue, as well as depression, all with strong psychosocial components. And there's also an increase in sleep disturbances, stress, and anxiety. In dental students, about 31% of individuals have TMD, with the most common group having disc displacement with reduction. In fibro, as I stated earlier, TMD is diagnosed in about 35% of patients, so very similar, probably because of the stress aspect. But in the general population, only 10% have TMD. TMD is associated with a variety of conditions, including chronic fatigue syndrome, tinnitus, sleep problems, and fibromyalgia. In 2020, researchers stated, quote, "First of all, Fibromyalgia patients' centrally generated pain plays an important role in TMJ pain and TMJ disorders. This could be clinical information for differential diagnosis. Therefore, there are different triggers between TMD and fibromyalgia. Neuropathy and central nervous system hypersensitivity, there's that word, could play a role in TMD, unquote. Meaning, your healthcare provider will compile a differential diagnosis, which is a list of conditions that share the same symptoms, to help make a final diagnosis. The differential diagnosis will direct your healthcare provider to offer tests to rule out conditions and lead them to find the cause of your symptoms. Usually, it's recommended to take an anti-inflammatory medication like Aleve, naproxen, or Advil, ibuprofen. Sometimes a muscle relaxant or an FDA-approved fibromyalgia pain drug are prescribed for TMD. But patients with fibromyalgia respond well to treatment with transcranial stimulation too. A mouth guard is often used, or traditional braces if the teeth are crooked. Be sure to get your cavities corrected and gum disease or other problems treated by a dentist. Proper dental hygiene is needed. The proper alignment of teeth is so important to make sure the teeth are properly aligned with your jaw. Sometimes incorrect chewing habits are the culprit. Chewing gum is out of the question. Yeah, I haven't chewed gum in years because my dentist said, nope, no more gum chewing. And I was an avid gum chewer. Rarely jaw surgery is needed, but in very severe cases, this might be required. An injury or misaligned teeth due to genetics or even tooth decay are some of the common reasons someone would need to have jaw surgery. Well, apparently, I have a crooked jaw. My dentist asked me if I'd had an injury, like broke my jaw, he said, when I was a kid, maybe. I said, I don't think so. I would think I would remember that. So I asked my mom, and she said, no. So apparently it's bad enough that he would ask me that question. Makes sense why I have TMJ. So sometimes you're just born with things that are a bit crooked and out of place. So I hope this made sense to you. I send you gentle hugs and support. Love you. Temporomandibular and masticatory and mascated. All of these TMJ and and my clock is chiming.